So I'm passionate about promoting an integrated model of health. And what that means is combining traditional Western or allopathic medicine, which treats disease with surgery and prescription medications, alongside complementary therapies such as acupuncture, reflexology, kinesiology, yoga, meditation even, and of course, lifestyle changes, including nutrition. And I think that the combination of all of those empowers us with our health and also optimizes our health and our health outcomes when we get sick. So today I'm speaking to someone who actually embodies this approach. Her name is Airmid Keogh. She's a fellow Cavan girl, and she is a registered general nurse and a licensed member of the Acupuncture Council of Ireland. So Airmid trained as a nurse in the UK, and she worked there and in France and Australia. And she also, as her career evolved, she became interested in health and well-being. So that's when she studied acupuncture. Now, her goal is to provide a service that is compassionate, comprehensive, and considers the emotional and physical needs of her patients. And her background in nursing and acupuncture provides her with the knowledge to provide care that complements both Western and Chinese medicine. And I couldn't agree more. So I hope you enjoy my chat today with our focus on acupuncture with Airmid Keogh. So hi, Airmid.
Hi, Lynn. How are you?
Oh, I'm good, and thank you so much for chatting to me today. Oh, not at all. I'm delighted. And so we're just putting a little bit of focus on acupuncture, which is one of your the treatments that you offer at Airmid Acupuncture Clinic. So I just thought that I would start off by asking you that with all of your medical experience and background, what sparked or kindled your interest in training as an acupuncturist?
I suppose it started off, God, years ago now, but whilst I was in London, I was working in, I suppose, a very hectic job, which actually I loved. I loved the job that I was in, but I just needed a boost, like we all do at times. I was a little bit run down. I turned to having acupuncture because I suppose from a Western medical point of view, I was considered healthy and well. So I had my first treatment, and to be honest, I couldn't believe how well I felt afterwards. So over the years, I would have regular treatments, and it just made such a difference for me. So I became very interested, but not only that, I suppose I was working in the medical industry, and I just observed where, I suppose there was a lot, I mean, of course, Western medicine works. I have to try, you know, it's absolutely, it transforms people's lives.
Of course.
We need it, you know. But there was a certain amount of people that were coming in with the same condition, you know, repeat prescription, possibly long-term medication. And I kind of felt that there's something missing there. So I kind of, you know, with TCM or traditional Chinese medicine, it looks at the root cause of a medical issue. And once you get to the root cause, really problem resolved. So that's, so it was always on my mind to go back to study. So when the time was right and a little bit more time to commit, I went back to college. Yeah.
Super, because that is, you hit the nail on the head. It's really about what's driving it as well as the root cause. We have a trigger, and then we have drivers of dis-ease in the body, and it's all about, I think you and I both agree that the reason why we're in these fields is because we understand what it's like to have quality of life. So it's about having energy to live your day to the fullest, you know, and do the things that you want to do and be as productive as you possibly can.
Absolutely.
It takes energy, doesn't it? Yeah, we don't want brain fog. You know these like fatigue and brain fog are so common, and they really they really impact our lives, but they're not necessarily a medical condition. You know, so getting.
And we were talking about it recently. You know, I've gone on holidays. You know, your main holiday of the year, and you actually come back when you're just feeling your best. You know, you kind of would love to be able to go on holiday feeling, you know what, I feel great going, as opposed to just needing a holiday.
Yes, exactly, to recover from your life. Exactly. So I wonder, Airmid, could you tell us a little bit more maybe about acupuncture in the context of TCM? You know, and a little bit more about the history of it and where it originated.
So TCM, or traditional Chinese medicine, it's over 2,000 years old, and it has been used since. I suppose the principle behind TCM is free movement of energy through these little channels or meridians which run throughout the body. And when one of these become blocked, it basically manifests as ill health. So I use these little fine, disposable, sterile needles into selected points depending on the diagnosis. A diagnosis is made by a detailed chat, like we have a good chat about exactly what's going on. And then I take blood pressure, pulse, and then I check the patient's tongue. It's amazing. It tells a lot about the general health of a patient or client. So then we go from there. You select your little points. You know, in TCM and Western medicine, we have the main organs, you know, the heart, the liver, the digestive system, and so forth. We have the same in TCM, except for we call them systems, and these systems basically depend on each other. So when one of those are, I suppose, a little bit weaker, and I think genetically we all have a system, like, you know, that maybe not all of us, well, I suppose I would say all of us have a system that is a little bit weaker than the other. That's why genetically we're predisposed to certain diseases or illnesses that are possibly our relatives. Yeah,
exactly, like weaker links in our chain.
Absolutely. And the one thing I realize is when you zone into that little, you know, that link, it often presents in different ways on different people, of course, but you tend to kind of maintain the health of, well, I'd like to think that, and certainly for myself, I worked out what the weakness is in my system, so that I could basically long term look after that a little bit better than possibly even the other systems. Yeah.
Very good. And I've had acupuncture. I think it's fantastic. It's amazing. But for people who maybe haven't had it, I think some people are sometimes put off a little by the thought of the needles. Now, obviously, I know that it's perfectly fine and they're tiny. But maybe would you tell us a little bit about the needles and about what it's like for the patient when they're inserted?
Look, I'm laughing because I actually fainted. I remember having a blood test years ago. I fainted literally. So yeah, needles. I come to over the years. I suppose, except that they're not too bad. But anyway, needles with acupuncture, they're so fine. They're so and they've evolved over the years as well. So generally speaking, most people will find it's generally accepted that they don't cause pain. Most people go into this, relaxation, deep relaxation, or even go into really deep sleep shortly after the needles are put in. Every now and again, you will, depending on the channel we're dealing with, if there is a little bit of disharmony on that particular channel or something going on, you will find it more painful in that channel. It tends to last for a second or two. The needles are left in for about 40 minutes. It gives a bit of time for the patient to completely relax. They tend to feel a lot better afterwards. And even when they're leaving, in most people, they experience a difference immediately. Sometimes it takes a few more treatments to make the difference. And
are there any particular conditions or diseases that acupuncture is, complements really well? Is it generally good for overall health, or do you find that you have people with particular issues coming for support?
Yeah, look, I think it's, I think it's good for everything. I like to, even for myself, I like to kind of think of, life can be challenging at times. And, I look at it as, I'll have it every now and again just to calibrate the body, get a new start, and
reset.
You immediately feel that boost in energy. Then for many, like I have a lot of clients at the moment that most people are on medications, I suppose. But if you look at at least over the age of 40, you have to admit it. I think
lifestyle driven, like high blood pressure.
Like
lack of sleep.
Yeah, totally. I think I see a lot of insomnia. I see a lot of palpitation is one of those things that I know it's related to anxiety for a lot of people, but they tend not to get to the bottom of it in Western medicine. They just tend to get all the investigations done, they all become normal for a lot of people. It does, you know, acupuncture is very good for that. I also have, like, just as a side effect, I have a guy in particular that I'm looking after for other reasons, for pain. But his blood pressure has come down to a point that he's halved his heart medication.
That's amazing.
And that's just a side effect over about 6 weeks. And then for really good for pain, I just find patients who, a lot of, one particular patient who's been on pain medication for over 2 years, quite heavy medications. And she's off her medications with about 60% improvement and can just tolerate that little bit. But we're getting there with her, you know. So everybody's different. But generally speaking, I'm often nicely surprised by some of the results.
Super. Yeah, I think it is amazing. Medication obviously saves lives, you know, prescription medication does save lives, but when people are on it, you know, long term for chronic conditions, obviously it can have side effects as well. So anything that can complement that, you know, allopathic treatment and reduce the need for prescription medicine has to be of benefit to your overall health, I think. Yeah.
I just want to say you would never recommend anybody to come off their medications.
No, of course, absolutely. And it would, exactly, so it would always be, you know, under the doctor's guidance that prescription medications could be reduced for sure.
But I do like to see somebody taking control over their, you know, their life.
Exactly, and learning about their own health and taking some ownership over their recovery, you know, and their improvement, their health improvements. So I suppose typically, now this is a very general question, which I suppose typically how many treatments would people need, or does that vary depending on what they're presenting with? Yeah.
It so varies. I mean, I have a lot of patients, just have a lot of people that just have a one-off treatment. And you know what, it could be for, I don't know, digestive issues, or it could be, like I had somebody in recently who, I think over the summer, I mean, think of in our weather, you know, it's so changeable. But she, you know, she had digestive issues, but it kind of went back to a lot of basically change of diet, cold drinks, various other things. One treatment plus infrared treatment, which just warmed up her digestive system, and it was enough to just bring her back to, you know, eating well and all of that, of course, as well. But just alleviated the pain in her digestive issues. She'd change a bowel habit, etc., as well. But resolved within, you know, 24 to 48 hours.
Amazing.
Yeah. So, and then people with long-term chronic conditions, you know, I often see them maybe for once a week for a period of time, and then I try and reduce them as they improve. It really does vary. Yeah, it varies from person to person.
And you mentioned the infrared there, Airmid. How does that work, or what way is that?
Infrared is fabulous. Now, it's not for everybody. So this is probably, we might leave this for another day, but there's certain conditions, particularly again in Ireland, you might feel warm, but there's certain parts of you feel cold. Does that make sense? A lot of people have this experience. It's a very kind of maybe cold feet, and yes, warm upper body area. It just means that basically the circulation is not just working as well as it should be, or else there's kind of a cold dampness trapped in one part of the body. Infrared basically works at penetrating to the deeper level of the tissue, and basically alleviating this dampness or coldness in the body, and then the body could just, it's an obstruction to the body, basically.
You often find that people say, oh yeah, no, I hate cold water, but I drink it warm, or I prefer stews and soups to salads. You know, people have that instinct, don't they? So it's fascinating, you know, the way the energy in the body works, you know, and the impact that we can interrupt it if it's, you know, in a negative state. I always learn so much when I'm talking to you, Airmid, and you know, I really enjoy talking to you because I think we both come at health from the same perspective. So I think it would be great to have a chat another day, and maybe we could talk about particular conditions, you know, in a bit more depth. I'd love that. But I just finish off today by I always finish off an episode with a store cupboard staple. So I suppose, just you know, what advice do you give your clients when it comes to food and nutrition?
I always go back to, you know, what you talk about, Lynn, because you know what, look, you've got a lot of knowledge and information, and I don't know a lot about food. I'm getting there. I learn from other people like yourself. But I do say, like, if you put poor quality diesel into a really good car, it won't run as well.
Yeah.
And it'll possibly conk out. And you know what? It's the same as ourselves.
Yeah.
I think we're all different. So different foods suit different people and so forth. But it's working. It really is getting in, you know, kind of listening to your body to just basically know what works for you. The other one is, you know, I think counseling and coaching, and in times of just when there's extra stress, just makes life a little bit easier.
Well, we take a little bit better care of ourselves, we can take better care of the people around us then as well, can't we?
I think one of the things, I don't know, certainly where I was brought up with, you know what, you look after everybody else, and then you'll be fine. But it really is, you know, try and just give you. I remember somebody telling me, you know, give yourself an hour a day. Okay, I couldn't, you know, that's impossible in a busy schedule. But I could give myself a half an hour.
Yeah, do what you can.
And that's enough to just, you know what, get away out of the, you know, get your little space and just, you know what, chill out for half an hour.
Great advice.
It gives you time to just, again, set yourself up again, you know.
Exactly. Take a breather. Airmid, that is super advice. Thank you so much. And thank you for telling us more about acupuncture. I really enjoyed our chat, and I look forward to talking to you again soon.
Lovely talking to you. And thank you for having me, Lynn. Okay.
Take care. Bye.
Take care. Bye-bye.
Bye. So my thanks again to Airmid for talking to me today, and I'll have a link to her website in the show notes in case anybody'd like to check out her practice in Dublin. So when I asked about store cupboard staples, I was delighted that she said just surround yourself with good food. We'd mentioned energy and vitality throughout the episode as well, so I thought that we'd focus today on bananas. Now, you're probably including them. I think that's one thing that most people do pop into their shopping trolleys, but I just thought I'd tell you a little bit more about the nutrients in bananas that you can actually appreciate, you know, the fact that you are including them already. So bananas have just the right amount of carbohydrates to give you a good natural big boost of energy, particularly after exercise. Now, they also contain potassium, and potassium is fantastic for your heart, so it's really good for heart health, and it helps you manage your blood pressure. And it also relaxes the walls of our blood vessels. So that's how it helps to lower our blood pressure. Potassium can also help keep our bones healthy as we age, and they help our muscles, and it helps our muscles to work better as well, and potentially help to prevent kidney stones, obviously, in the context of your whole diet. However, if you have kidney problems, you don't want to have too much potassium. So just if you have kidney issues, just check your potassium levels as well. Now, obviously, like as with other fruit and veg, bananas have fiber, and we really need like an average size banana would have approximately 10% of the fiber that you need every day. So it really does contribute to that. And obviously, fiber is going to help keep your cholesterol and our blood pressure in check. It helps to ease inflammation, and also obviously really good for your gut. Foods that are high in fiber also help us to stay feeling full, so they're always a good choice as a snack. Because they're not going to give us a sugar spike, you know, and then that's when we think we need to eat, you know, the whole packet of biscuits instead of just a couple. So again, you know, in the context of an overall healthy diet, so bananas can help improve yeast and urinary tract infections. They can also help with gastrointestinal infections. They can ease IBS symptoms. And as I say, have the right amount of carbohydrates. So they don't have too many carbs. So obviously, if you're diabetic, you know, they don't have too many that you need to avoid them. So you can have, say, with diabetes, you could have, say, half a banana, you know, at a time. Now, they also contain a number of vitamins and minerals. So, for example, vitamin B6, which is involved in energy production as well. So a banana would give you about a quarter of the B6 that you need every day. So that helps with metabolism. And metabolism is how we convert food into energy. It also has a role, vitamin B6 has a role in brain development in pregnancy and infancy, and also it's part of supporting our immune system. So vitamin C is also really important for our immune system, and a banana will provide you with some vitamin C as well. And vitamin C, as we know, helps to prevent damage caused by free radicals and oxidative stress. So it also helps us to heal, so we heal better. Bananas contain magnesium, and this helps to control our blood pressure again. So again, really heart healthy, and blood sugar, and also helps to keep our bones strong. So we need magnesium for our bones and our muscles. So when we contract our muscles, we use calcium, and when we relax our muscles, we need magnesium. Bananas also contain vitamin A, and this is really good for vision. And it's obviously one of the things that we can take to help support or fight against the risk of cancer. So all in all, it's a pretty powerful little fruit. And as I say, it's a popular one, so I don't think I need to persuade anybody to include bananas in their diet. But there's just a few reasons of why when you're popping them in your shopping trolley this week, you can actually really appreciate them. Them.